Most parents get their children immunized against common diseases without concern, but childhood vaccinations required for children to go to school remain controversial to some parents. Doctors like Scott Grant, a pediatrician at Children's Hospital of Michigan Detroit Medical Center, hears all the arguments.
The vast majority of parents just are trying to do the best that they can for their kids. If we can address that conversation in that way and make sure that they have the information that they need to make a good decision, a lot of them come around to that conversation eventually.
Dr. Grant says the fact that several vaccines have been in use for years provides comfort for parents who are concerned. They got the same shots when they were kids. However,
how is it that a child can get something like chickenpox, even if they've been vaccinated?
We know that not all of our vaccines are 100%. We know that there are certain subsets of the population that for whatever reason don't have the response to the vaccine that the average person does. The other thing that can happen is over time, usually that immunity wanes a little bit, and so as they get older, that risk might increase as well.
In his discussions with parents who are hesitant, Dr. Grant says it's important to walk the walk.
My kids are all fully immunized, and I'm vaccinating them on the regular schedule to try to protect them from these debilitating diseases.
I'm Dick Haefner for WJR HealthWatch. Doctors remain frustrated over controversy surrounding childhood vaccinations.
We have seen some declines in vaccination rates. We're certainly trying to make a push, just try to get kids plugged back into their primary care physician, which is another really important thing, because in the primary care setting, we do so much more than just vaccines, and certainly as part of that, to get them caught up on those routine vaccinations.
The medical community points to mountains of data showing the safety and effectiveness of vaccinations for children. Dr. Scott Grant, a pediatrician at Children's Hospital of Michigan Detroit Medical Center, says the flood of medical information due to the pandemic may help.
Because they now have a prior understanding of a lot of the vocabulary that we use that previously doctors might not have done a good job of ensuring that families understood.
Dr. Grant says a good relationship with the family doctor can make it less likely that parents would resist vaccinating their children.
I think that works well in vaccine discussions, but it also works well when we start talking about things like nutrition and growth and development and playtime and tummy time and all the other things that we as pediatricians talk to families about in terms of developing their child's sense of well-being and their ability to be resilient and their ability to thrive, right? That's what we really care about in pediatrics. And again, vaccinations are a really important part of that, but it's certainly not the whole story.
As for his family,
I, as a parent and as a pediatrician, am doing this for my kids. So I'm not asking them to do something for their children that I'm not doing for my own children.
I'm Dick Haefner for WJR HealthWatch. Children starting school are required to have basic immunization against communicable diseases, including measles, mumps, and chickenpox. In recent years, a growing number of parents have resisted getting their kids vaccinated.
Every parent out there just wants to have accurate and correct information so that they can make the best choices about the health and well-being of their children, and so that's a place where we as pediatricians try to be as helpful as we can.
Dr. Scott Grant is a pediatrician at Children's Hospital of Michigan Detroit Medical Center.
Parents want to be confident in the decisions that they're making regarding the health and well-being of their children, as is their right. So many times these conversations have to happen slowly over time. I can list on one hand the number of times I've just walked in and addressed all of their anxieties, and away we went.
In Michigan, parents can get waivers for their children for medical, religious, or philosophical reasons through their local health department. Dr. Grant says much of vaccine hesitancy is the result of bad information from the internet or social media.
There are plenty of places on the internet that will try to stoke the fear of parents about immunizations or other types of health interventions. There's a whole huge industry trying to convince parents that they're not very good parents, and if they just buy this one product or they do this one thing, that they would be better parents, right?
When he encounters hesitancy, Dr. Grant says his own personal example gets their attention.
My kids are all fully immunized, and I'm vaccinating them on the regular schedule to try to protect them from these debilitating diseases.
I'm Dick Haefner for WJR HealthWatch.